Okay, now we're going to be demonstrating the different injection sites for subcutaneous injections and intramuscular injections. The first injection site that we'll be looking at is the deltoid. The deltoid is located on the upper part of the arm, and you can see the muscle by moving the patient's arm like this, and it's the muscle that's right here. Now, for the bony landmark, is going to be the acromion process. And once you find the acromion process, you go 3 fingers down from the acromion process and then make a V shape. This V shape is where you will give the intramuscular injection. Now, with this site, it is the smallest site of muscle for the injection, so you can only use small needles and small amounts of aqueous solutions for the intramuscular injection. Now, the next site that we'll be looking at is the dorsolateral aspect of the arm. It is located on the lower part of the upper arm, and it is right below the deltoid and right above the elbow. So what you would do is, using the lateral side of the arm, you would go 3 fingers up from the elbow and 3 fingers down from the deltoid, and this rectangle shape that it gives you is where you would give the injection. This injection site is for subcutaneous injections. Therefore, you would give it at a 90-degree angle or a 45-degree angle, depending on the amount of subcutaneous tissue and the size of the needle. The third injection site that we'll be looking at is the abdomen. Can you lay down for me? Lay down. All right. For the abdomen. Hold on. All right, so for the abdomen, this is the subcutaneous injection site. You will not go above the costal margin or below the pubic area, and you will not pass the anterior superior iliac spine. Then you will avoid a 2-inch border around the umbilicus region, and then you're left with a U shape. This U shape is anywhere in that U shape is where you can get this subcutaneous injection. Now, with this injection, it allows for you to give multiple injections. So usually when you have to give a subcutaneous injection, this is the preferred site, because you can do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. All right, and then the anterior superior iliac crest, this is the top border or the anterior part of the iliac crest. Now, for the fourth site that we're going to be looking at today is going to be the ventral gluteal. It is best found by having the patient face towards you. Turn towards me. Turn towards me. And what you would do is you have to locate it by finding the greater trochanter, and you can do that by lifting the leg up. All right, and once you find it by lifting the leg up, you just put the heel of your palm on top of the greater trochanter. You have your thumb facing the pubic area, your index finger facing the iliac crest, and then you have your index finger facing the anterior superior iliac spine, and then your middle finger facing the iliac crest. This V shape that it gives you is where you would give this injection. This is the preferred injection site for intramuscular injections. Now, the first thing you would do is palpate the injection site. If you feel a bony area, then you might have to adjust it depending on the patient's size. So after you palpate it, you will wipe it with a alcohol pad. After you wipe with the alcohol pad, leave the alcohol pad facing the direction that you've already cleaned, so that way you will know where you're going and you can move your hand and inject it. For the injection, you will do it at a 90-degree angle for the intramuscular injection. Now, the last injection site that we'll be dealing with today is the vastus lateralis. This injection site is used for both subcutaneous and intramuscular injection. Now, you can find it by locating the greater trochanter. All right. Now, once you do that, you have this huge border. So you will go a hand slit down from the greater trochanter and a hand slit above the knee. And this large rectangular square is where you will give the injection. So for the intramuscular injection, it's usually preferred to do it in the 1/3 of the space that you have, and you will clean it with the alcohol pad, and then inject it at a 90-degree angle. Now for the subcutaneous injection, the subcutaneous is found over a layer over the thigh, and it's called the anterior thigh. So this, you will give it at a 45-degree angle or 90-degree angle on the other 2/3 part of this area, and making sure you don't go above or away from this midline leg or the midline leg of the side. Now this concludes the demonstration part of the video.